Good morning everyone. I am Dr. Sunil Agrawal, consultant newborn and child specialist, Fortis Hospital, Mohali. This year, where everyone is going through a difficult time, that is COVID pandemic, it's more so critical, and it is very much important we understand the benefits of immunization, and we should not miss immunization of our babies. So you all know immunization or vaccination is basically a method or by which we inject certain antigens or vaccine to a baby or to an adult, and subsequently the body produces antibodies and certain other T cell response, and by which our body is protected from further catching the disease. And there are many diseases which have been eradicated or has been eradicated, successfully controlled by proper use of vaccination. But I do understand with this COVID pandemic, many of the routine vaccinations which babies need to go vaccination, that is not being happening. It's a difficult time. I do understand many times parents are not well. Going to a hospital is a fearful thing, we do believe, and you also are fearful to take the baby outside. The primary aim or primary fear you all have, my baby, is that my baby or we should not catch a COVID infection. But during all these things, if we are missing on the routine immunization, then babies may not be protected against the diseases which they should be protected by immunization. As you all know, children, they need to be vaccinated at scheduled interval starting from birth, and subsequently at birth they receive BCG and hepatitis B, and subsequently at 1.5 months, 2.5 months, 3 months, 3.5 months, then 6 months, and then 9 months, at 1 year, at 1.5 year, 15 months, at 2 years. So there is a schedule, and all vaccinations are to be given at their recommended time. We cannot or we should not delay getting vaccinations. If we are not getting the vaccinations at recommended interval, then our kid or our child will not be protected against the disease. And many times it has been seen that during pandemics and when the routine immunization is interrupted, measles and other diseases, there is an outbreak and we are susceptible to those bimari. So yes, we need to take due precaution so that we should not get COVID infection, but we should not delay or postpone the routine immunizations. So talk to your doctor. He will arrange everything for you to make your transit to the hospital as smooth as possible, and as less time you spend in the hospital. Take a prior appointment and booking so that you are there at right time and you get the vaccination at the earliest, and you leave the hospital at the earliest. So next question arises, what all we should take care when we visit a doctor or clinic. I think the routine COVID appropriate behaviors have been talked widely, like the 3 basic principles like hand hygiene and social distancing, masking. These we have to follow, and don't fear that we will get an infection or a COVID infection by visiting a doctor and a hospital. There is a risk benefit ratio, and the benefit of getting vaccination timely much more or outweighs so any potential risk, and which we will be trying to minimize the risk of catching the infection during your hospital visit. So I appeal all the parents to get their vaccination at a regular interval, specifically the primary immunization series, which is last for initial 1.5 to 2 years. That one should get at a regular interval. We should not delay much. Okay, thank you.